Hi guys, I've said before, what is the point of government if it doesn't look after the health, education and well-being of its citizens? Just this week, the private health insurance provider Aviva joined AXA in telling the public that the crisis facing the NHS means they have gained about 170,000 new customers. It must be true that every crisis means an opportunity for some. This wouldn't be happening if the Tories were properly funding the NHS, were making sure that staff were recruited and retained, and if they were not pushing for more privatisation. Dr. Andrew Meyerson delivered this passionate plea to save the NHS.
7.6 million people on the longest waiting list in NHS history. And now people are using private healthcare because they're forced into it. They're being held hostage by a government that refuses to invest in the NHS, refuses to fix the main problems of the NHS. A government that is allergic to the word retention. They don't want to talk about staff retention. And it is so sad as a clinician on the front line witnessing this. Can I be brutally honest with you? I don't believe that the British people are safe with this government running the NHS. I firmly believe that they have allowed the system to go from the best in the world 10 years ago to among the worst in Europe now. I think that's just awful, and they do not deserve to look after the NHS any longer.
There's a sort of bitter irony here that you have an American guy trying to save the NHS from a British government. And he has warned before in the past about how the NHS is going down the road of an American model where you have private health insurance providing care for people, basically. And those who don't have health insurance are going to be abandoned. Now, at the moment, that's not the case, but that is the plan. More and more people are going down the route of private health insurance because they can't get the treatment they need. Or they believe that the NHS is too broken to provide them with the treatment that they need, that they don't want to wait. And you can't blame the public here. If people have the money and they need treatment, then you can't blame people for using private health insurance or going to private clinics or using the private sector. But it shouldn't be like this. As he pointed out, 10 years ago, the NHS was the gold standard. It was number one in the world. What has happened since then? Of course, the Tories have both underfunded it, but whatever funding that has gone in, a lot of it is siphoned off to the private sector. So somebody's making a lot of money, but it's not getting to the customer, in a sense. It's not getting to the patient. And that's the fundamental problem here. The NHS can't retain the staff it needs. It can't pay the wages it needs. And this means that doctors, nurses and other staff are leaving. And then, of course, when they leave a massive workload on those who are left behind. Doctors and nurses are struggling. They join it out of vocation, but they can't live on that. They need decent wages to pay the bills, to feed their families. If they don't get that, of course, they're going to either work in the private sector or they're going to leave the country altogether. We've covered it before about how Australia and Canada are welcoming British nurses and British nurses feel more welcome in Australia and in Canada because the hours are less and the pay is better. But the NHS is struggling because of policies that the Tory government have implemented. It's an ideology at this stage. We want to crush the NHS, create a two-tier system like in the United States, where if you have health insurance, you're okay. If you don't, you're frigged. And unfortunately, it seems to be going in that direction. And I fear that the Labour Party will continue in that direction too. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.